Patients in need of medical marijuana can start applying today, according to the North Dakota Department of Health. It's also accepting applications for designated caregivers to dispense it. But just how accessible will the cannabis be? Valley News Team's Rose Itzkovitz asks medical professionals as well as those behind the measure and has our story.
Back in 2014, Riley Ray Morgan, a financial advisor in Fargo, began his grassroots efforts to legalize grass.
I had some back issues and I went to Germany and had a disc replacement surgery that didn't go well.
2 years later, Measure 5 to legalize medicinal marijuana passed. But now, 2 years after that,
I think most everybody was very disappointed on the inaction, not only by the legislature, but by the State Department of Health.
But finally, as of Monday, North Dakotans can now apply to be eligible for medicinal marijuana. But just how easy will it be for them to get it? Morgan says it won't be.
You know, I think there are medical doctors out there that would grant their patients to get medical cannabis cards. However, the powers that be, where they're employed, I think are holding them back.
What makes you say that?
I've heard of people from all over the state basically have talked to their doctors and they said absolutely not, because, you know, Sanford or Essentia has basically said we're not going to allow you to do this. Because if something should go wrong, they might have some liability issues there.
I reached out to the hospitals as well as many independent doctors in the area and got nothing back. The North Dakota Department of Health says with the application, you'll need not a prescription from a doctor, but a certificate. So what exactly does that mean?
On a prescription, it's going to have the exact medication. It's going to have an amount. Those types of items are not found on the written certification form.
Instead, doctors will be asked to simply identify the patient's debilitating condition requiring the medicinal marijuana and how long they would need it for. But Morgan says it's not just as easy as finding a doctor who will fill your prescription.
Technically, you're supposed to be a patient for 1 year before this doctor can allow you to apply for a medical cannabis card.
One last hurdle, Morgan says doctors and LPNs can prescribe medical cannabis, but the legislature leaves out physician's assistants. In Fargo, Rose Itzkovitz, Valley News Live.
The North Dakota Department of Health says it will now start processing applications, but probably will not start printing cards until at least mid-December, closer to when the product is available. For more on the requirements to apply, as well as where dispensaries will be located, head to our website, valleynewslive.com, and click on this story.